Are there further amendments to this title? Mr. Rush.
Mr. Chairman, I have an amendment that I'm going to introduce. However, I am going to withdraw the amendment. Mr. Stupak and I have sponsored H.R. 444 to make critical improvements to the 340B drug discount program.
Well, the gentleman has an amendment. We'll consider it read and distributed. The gentleman is going to be recognized to explain the issue, and as I understand it, is going to withdraw the amendment thereafter.
I will.
The gentleman is recognized for 2 minutes.
Mr. Chairman, Mr. Stupak and I have introduced H.R. 444, and our legislation would extend the discount to inpatients and expand eligibility to the program, the 340B program, for a number of rural hospitals. And I want to emphasize to the committee 3 reasons why we believe these changes are so important for low-income patients and why we believe this legislation should be included in the stimulus legislation. First, the current policy of providing safety net hospital discounts on life-saving drugs provided to vulnerable outpatients but not vulnerable inpatients, even for the same exact drug, makes absolutely no sense policy-wise. This amendment will rectify this problem by allowing safety net hospitals to utilize the 340B discount for all patients that they serve, whether the patient is in a low-income clinic or admitted as an inpatient. Second, our legislation will enable small rural hospitals to also be able to utilize the 340B discount for their patients, absolutely essential to expanding access to drugs in economically distressed rural areas. Thirdly, our 340B legislation will help to stimulate the economy by providing savings to states and savings to safety net hospitals for the benefit of the vulnerable, low-income, and uninsured patients for whom 340B discount is provided. Mr. Chairman,
Gentleman, yield to me. Oh. No, I didn't mean to interrupt you. I wanted you to yield to me.
All right, Mr. Chairman, I want to recognize yield the balance of my time to Mr. Stupak.
Without objection, gentlemen, be given an additional minute.
Mr. Chairman, I'll be very brief, and I thank Mr. Rush for introducing this legislation. The discounts through the 340B program are quite significant. On an average, it's about 40 to 50% less than the average wholesale price. However, the 340B program is only for outpatient drugs. As a result, hospitals have to pay an average 25% more for drugs given to patients that are admitted to the facility to stay overnight. Not only does this result in higher pharmaceutical costs, but then the hospitals have to maintain 2 pharmacies and 2 pharmacy inventories. Mr. Rush's legislation will not solve our health care woes, but goes a long way towards ensuring that safety net hospitals in this country can continue their mission of providing health care to all patients, regardless of their ability to pay. It's a good common sense, cost-saving measure.
Mr. Rush, if you yield to me, I want to express to you my strong willingness to work with you and Mr. Stupak on this issue. I think the high price of drugs is an important issue for this committee's consideration, and just the example of what we've done for those who have been on Medicaid and switched over to Medicare, I think it's costing us a couple $2 billion a year. Same drugs, same people, just a couple $2 billion more in costs. And if we could get the lower price to some of these institutions, it would mean a lot of savings for them as they're providing care for very low-income people. So I want to pledge to you to work with you further on this, but not in this bill, in some other legislation later this year.
I want to thank you, Mr. Chairman, and with that, I withdraw the amendment.
Without objection, the amendment's withdrawn.